Thank you for this opportunity to be up here and present on mental health, which is such a um, important topic and very relevant for our lives. I'll start up with a prayer, and then we'll get started. Heavenly Father, we come before you humbled, knowing that you are the creator of everything. Um, you ground us, you give us everything that we need for life and godliness. As we talk about this topic, we pray that you open up our eyes, our hearts, our minds, that you help us to know that you've put resources in the community for us to seek and to complement our spiritual walk. God, we love you. We pray that this time honors, glorifies you. It's through your son Jesus that I pray. Amen. So before we get started with this presentation, we're going to do a recap of the last presentation, which was spearheaded by Paula and Carissa. So Carissa's going to come up and ask a few questions to see if people remember.
Maria. So thank you all for everyone who came last time. We really appreciate it. We got to talk about Mental Health 101. And so what we're going to do is just ask 3 questions, right? For each person, we just would like for someone to volunteer to answer a question pertaining to what we did, what we talked about last time, okay, around mental health. So the first one is, what is mental health? Does anybody have, can anyone answer that, what mental health is? And it doesn't have to be the Webster's Dictionary definition. So would anyone like to volunteer to answer that question? What is mental health? Okay, that's okay. We'll go to another one then. No problem, no problem. Thank God I prepared a few. True or false? Would that be better? It's true or false, okay. Mental health and mental illness are the same thing. True or false? Okay. Oh, sorry. I needed one volunteer because we have a little incentive, right? Something that thanks to Miss Cheron. Okay. Excellent. False. Right. Exactly. Exactly. That's true. I should have said that. Right. Thank you, Maxie. Woo. False. Every single person from the time you're born until the time we pass away has mental health. You know, mental illness usually refers to a diagnosable illness that you go and get from a medical professional. Okay, so that's so good. Oh, and then what is mental health? See, that's true. Thank you. Okay, mental health is our emotional, psychological, and social well-being affecting how we think, feel, and act. So that's what mental health is. And then, could anyone answer? Name one common mental health condition we talked about. Is anyone? Okay, yes, Sean. Anxiety, perfect. Yes, we talked about anxiety, depression. Woo! Awesome. That's good. Good. Thank you. Yeah, we talked about anxiety, depression, trauma, and stress. And then another one is okay, this is okay, this is not hard, but I think even people who didn't come last time could probably come up with this answer as well. What's one healthy way to cope with stress or anxiety? One healthy way. Okay, thank you, Sean. But let's do Cynthia, if that's okay. Meditation. Awesome. That is really good. Thank you. Good job. Thank you, guys. You did a great job. Maria, thanks so much.
How many of you, by a show of hands, were here during the last presentation? Okay, most of you. We have a few people that weren't. So some of this is going to be a recap, and it's going to reinforce what Paula and Carissa already shared. Before I start, I'll share a little bit about myself. I've been part of the church for more than 20 years now. It's really like family at this point. Professionally, I'm a psychiatric nurse practitioner. I've always liked and enjoyed the mental health field. That was solidified in undergrad when I was doing my nursing degree, and we go through clinical rotations, and you work with the kids, you do psychiatry, you do, the medical units. And when I did my psychiatric rotation, I knew that that's what I was cut out for. And that ensued me pursuing my graduate degree, and I've been able to, used that in a varied different types of settings. I've worked in acute mental health hospitals, working with children, adolescents, and adults. I've also worked with less sick individuals in outpatient communities, and I've done also a lot of research. So it's as I was reflecting on my experience, it's unbelievable that I've been doing this for a couple of decades now. So I'm privileged to be here and share with you about the work that I do. So Carissa kind of stole a little bit of my thunder because my first question was, what comes to mind when you think of mental health? And so some of you, some, actually, did people share? If you think of synonyms that come to your mind when you think of mental health, what do people think of? Mateo, your emotional state, yeah, yes. Isolation, okay. Yes, Sudana. Illnesses, okay. Laura, depression, okay. So we learned that mental health and mental illness are sort of two separate things, right? And here we see that mental health includes our emotional, psychological, and social well being. It affects the way we think, feel, and act. I like what the World Health Organization has to say about mental health. Mental health is a state of well being, mental well being that enables people to cope with stress, with the stresses of life, to realize their abilities, to learn, to work well, and contribute to their community. So it not only has an individual impact, but when our mental health is fragile and compromised, it impacts our ability to function and our ability to give back and sort of live in a community. And we are social beings that are connected in community in many different ways. Some I'll move pretty quickly through these things because some of these have already been touched on, but for the sake of those that weren't here last time, there are some common signs and symptoms. There are a host of them. They're really dependent on the diagnosis that you receive. So I'll just run through these briefly. So we have mood changes, and that can include sadness, low mood, but it can also include the opposite of that, which is irritability or excitability. It's really important for us to know what our baseline is. If we're naturally a I see the cup half empty type of person, so we kind of have a blue predisposition already. It's important for us to know that about ourselves so that when we see ourselves tipping a little bit more than that, that's a red flag for us. If we normally have a more bubbly personality by, predisposition, it's important to know when we're deviating from that, because it might be a sign that something is happening. Um, We also have excessive fears and worries. We used to think about, or we think about anxiety as irrational fears. There's so much happening in our nation right now that things that used to be irrational are no longer irrational. Right now, we're afraid of gun violence, right? Because it's so common in our nation. If I don't know, some time ago when guns weren't such an issue and that sort of violence wasn't so prevalent, you go into an office and you say, I'm afraid I'm going to get shot. Somebody might say, that's kind of an irrational fear. Nowadays, it's not so irrational. So some things that we might have classified as irrational before are no longer irrational because of the circumstances that we're living in. It's important for people to know us, right? For people who are close to us, to speak into us, because sometimes they might notice some things that we don't notice, or some things that we might dismiss and say, oh, I can manage this. Another person might say, Maria, this is a deviation from who you normally are, and I'm concerned, right? And it's important for us to bear those things in mind. We have withdrawal from friends and activities. With children, this is particularly important. Children don't always have the vocabulary, they don't always have the understanding of what may be happening with them. But over time, they will show it in different ways. They will show it behaviorally, They will show it sometimes in isolation. And so it's important for us to cultivate as families with kids around us an environment where we openly speak about these things. We know that schools are teaching it, because it's so prevalent in our schools. Suicidality is such a common thing now. Kids see it around them. So it's important for us to have a platform where we cultivate mental health talks for our children, and to tap into their well being as well. How are they doing academically, athletically, socially? What's going on? Don't dismiss things. There are times when kids are attuned with what's going on, and they'll say, Mom, Dad, Auntie, Uncle, this is what's happening. And sometimes it takes the adults to sort of catch up and say, let me look into it, and not be dismissive, or think that it's not a big deal. It's important for us to attune to when a child, an adolescent, is communicating that something is wrong, because that takes a lot of courage, and it takes a lot of guts to be able to say that. um, Changes in perception. So, perception is the way we think, how we see the world. We might have changes in our sleep patterns, eating patterns, and in just generally the way we function. We know that mental illness is of great consequence when left unattended. A cardinal sign to look out for in mental health, and this covers pretty much every diagnosis that we cover in the mental health world. All of them, if not all, have these signs and symptoms that are a cardinal sign. Whenever you feel significant distress and or have impairment in functioning, it's pause for concern and alarm. And sometimes it happens abruptly, depending on the mental health issue that you're talking about. Sometimes it happens sort of slowly, which is why it's important to keep in mind that we should be attuned with some of the red flags that creep up in our lives. There are times when we can push through the distress, and say, oh, I got this. Even mental health professionals, we too, befall to the stigma of mental health. And sometimes we think that we can push through certain things until an illness sort of declares itself more openly and leads us to seeking the help that we need. But we know that ignoring and pushing through the distress, through the dysfunction, will ultimately, or can ultimately lead to deterioration and externalizing behaviors. For kids, some of these externalize. Thank you, son. For children and adolescents, some externalizing behaviors can be, like we've said, withdrawal. They sleep in, they stop wanting to hang out with friends. Some of them cut themselves, etc. Um, so, why do we think mental health matters? Now that we know all of this, a raise of hands. Who wants to give it a shot? Why does mental health matter? Does it matter? Okay. So, why does it matter? Why do we think it matters? Yes. Yep. Family well being. Jonathan? Yep. It helps us function day to day. Yes. Very good. So, mental health influences our daily life, our relationships, and our physical health, right? It can lead to something that can start in our mind as we deteriorate, can lead to other consequences, even physically, right? Left ignored, unassessed, untreated, mental health symptoms can get worse. They create dysfunction and at times may lead to serious, sometimes fatal consequences. It is important to seek help and interventions early and not wait. It's a brain disorders, right? When there's dysfunction, dysregulation in our brains, the more we leave our brain unattended, the harder it can get to put us back together. So when we notice the signs early on, we should seek help early on so that we don't allow our brain to be in disarray for long periods of time and we can seek the mental health treatment that we need. It can lead to comorbid disorders, right? When we leave our brain in disarray, when we're struggling with deep anxiety and depression, and we don't know how to cope, we might turn to substances. So now we're dealing with anxiety and we're dealing with substance abuse. But if we would have dealt with the anxiety early on, we would have avoided perhaps this negative way of coping. Um, some people say, what comes first, anxiety or depression? That's kind of a question that in the mental health world we can think about it. Really, it doesn't really matter. When as clinicians we deal with symptoms, we want to treat the symptoms. But it's true that when we have excessive fears, we're dealing with stomach ache, palpitation, we don't know how to manage the physiological reactions of our bodies, our brains are running at 100 miles per hour. It can lead to hopelessness, helplessness, and now we're also dealing with depression on top of the anxiety and maybe some other physical things that can ensue because of that. Another example are children with ADHD, right? A lot of times the teachers might report disruptive behaviors. Your child is unruly, they don't pay attention, they won't sit still, they're causing trouble, they're throwing crayons, they're rolling on the floor. I think more and more now the schools are prepared or more ready to kind of assess and screen some of these things. And it's important for parents, and I think maybe Opal and Lisa might go into this a little bit more in the next presentation. It's important for parents to heed what teachers are saying. For the most part, children want to do well. They want to do well. When they aren't doing well, there usually is, when we dig underneath the surface, there are things happening, whether it's a family situation at home, whether there's a brain imbalance because they have ADHD that's untreated and so they can't focus. So when you can't focus, you disrupt, right? That's what kids do. Whether it's an incident in school, bullying, or something else. So we have to be mindful of these things and not punish children because they're acting out behaviorally. Let's dig first to see what's happening. Poor mental health can lead to serious conditions. We already touched on that. There is hope in seeking help. There's hope in seeking help. There's a lot of supports. There are a lot of treatments available. It's not, I'm thankful, such a stigmatized topic, but it still is. So we have to continue to push through that. But there is hope. So symptoms can eventually lead to common mental health issues or disorders. Depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, phobias. And we know that within each category, there are sort of subsets of diagnoses. So these are just broad categories of mental health diagnoses. We have attention deficit hyperactivity disorder. As kids get older, sometimes they lose that hyperactivity, or adults, they can have attention deficit disorder. We have bipolar disorder, we have schizophrenia, which involve more perceptual disturbance, can create psychosis. We have substance use disorders and addictions that also exist. That's sort of a subspecialty of mental health disorders. And we have eating disorders, we have personality disorders, just a host of um, mental health issues that are common and that we might see. So what are some causes of mental health problems? We know that it's a triad. We know that biology works with the environment and works with social factors. They all interact together to influence whether somebody has the propensity of becoming mentally ill. Some things get triggered at different times. Some of these things we can't predict. We don't have control over. We know genetics and family history is a big factor. Genetics, it's our brain, right? It's wired. We know that when we have children, we have multiple kids. Somebody might say, "Oh, this kid is this way, this kid is this way, and you wonder why the two children are so different from each other, even though they were raised in the same home. So some of us have our predispositions, our propensities. Like I mentioned, somebody might be a little bit more on the blue side, somebody might be a little bit more irritable. That's kind of like their predisposition. Um, we know that for genetics, there's the brain hypothesis. We have chemicals in our brains that help us function. They regulate sleep, they regulate appetite, they regulate our emotions. Different parts of our brains regulate how we perceive, our cognition. So when there are disruptions in these chemicals, then we have symptoms of mental health disorders. Trauma or abuse can lead to mental health disorders. Loss, grief, transitions in life can sometimes overload an individual and overload our capacity and exceed our capacity to cope with these stresses and to manage emotionally and mentally. And so when we're sort of tipping over the cup, then we find ourselves managing mental health symptoms that can trigger deeper things for us. Substance use, substance abuse. We know that many street drugs, even legal ones, affect the way we think, the way we operate, they impair our brain, and so that can lead to long lasting illnesses. We know that cannabis use, which is now legal in most states, has a high correlation with schizophrenia. It's upward of 50% of people who use cannabis, and later on in their life, they experience psychosis that never reverts, and now they're dealing with the diagnosis of schizophrenia. So it's very important to educate ourselves and educate our young people. Long-term stress, even good stress, can overload our capacity to cope. Loss, grief, transitions in life. As women, there are many women in here. We know that there are very vulnerable epochs in our lives. Childbearing is one of them. We have postpartum depression. We have hormonal changes during that time. We have premenopause and menopause, which can lead to another surge of hormonal changes and can be associated with mental health symptoms. For children, their brains are growing, are developing. Transitions for them are also difficult. Adolescence is a critical period for them when they are trying to know their social environment, who they are, forging their identity. This is a very difficult period for them, as well as young adults who are leaving their home. They're at an exceptionally vulnerable position as well, because we know that the brain continues to mature well into our mid-20s, but now they're leaving their homes, leaving maybe the protections of their parents and what they know, and maybe experimenting with some things. And so they are at a vulnerable place as well, which is why education is very important. Any questions so far? So these are some mental health myths and facts. They don't line up very well, but we'll follow along. So mental illness is rare. That is not true. Mental health conditions affect about 1 in 4 adults per year. So if we count here, we have some people who have dealt with mental health issues. Only people with severe mental illness need treatment. That's also false. Treatment can be beneficial for people with all levels of mental illness, from mild to severe. In fact, seeking help when your symptoms are mild is optimal, because we want to avoid getting to a place where we're really dysfunctional. Children and adolescents cannot experience mental illness. Wrong. Mental health conditions can develop at any age, including childhood and adolescence. And with children, sometimes you can have co-founding things if they have developmental disabilities like autism or other sort of developmental delays. Sometimes they can also manifest mental health issues. So it's important to definitely tap into clinicians for this type of support. Mental health problems are only a personal issue. Sometimes we tend to think that way, right? To protect ourselves. The stigma tells us that it should be private. Um, but that's wrong too. Family, friends, community, and professional support play a vital role in helping people with mental illness recovery. In fact, we need the support. Can't do it by ourselves. When we're really at a place where we can't function, we need the support. Mental illness is a sign of weakness. For many, many centuries, I think we have believed this lie, but it's a big lie with a capital L. Mental illness is a medical condition, it's a brain imbalance, not a character flaw. To illustrate this, a lot of times when I worked with my patients, with their families, we used to come together and say, okay, is this family psychologically minded? And that was a term that we used to sort of classify whether this family knew anything about psychology and psychiatry or they did not. And a lot of times we would start with medical conditions because people can relate to those. So let's look at this case study. This is the pancreas, and we're talking here about diabetes. Diabetes is known as a medical condition. It's a chronic disease characterized by high blood sugar levels. The pancreas, which is the organ we see here, can't produce enough insulin or cannot use the insulin that it is making effectively. And we have type 1 and type 2. I won't go into all those details. But we know that treatments include lifestyle changes, medications, and ongoing monitoring of sugar levels. When we fail to do this and we leave it sort of to its own devices and don't seek the help that we need to seek, we can deal with heart disease. We can deal with stroke because the illness sort of harbors and spreads and starts to affect other organs and other areas of our lives. We can have kidney disease, we can have nerve damage, eye damage, foot problems, and diabetes untreated can be fatal. Um, when you go to a doctor, the doctor will assess you and say, well, this is an early stage of diabetes. Let's monitor your sugar level. Let's make some lifestyle changes. And you might start there. Over time, your doctor might find that, okay, you have a family history of diabetes, your lifestyle changes aren't enough to manage the illness and the symptoms, and they might decide that medication is what's more effective and what's needed in addition to lifestyle changes. Some people make lifestyle changes, they're on some treatment for a while, and then their lifestyle changes help stabilize everything. And the doctor might say, well, in fact, let's see if you can do this without the medication. It's a similar process for mental health issues. Let's start with anxiety. We already know that mental health issues are brain imbalance. The chemicals in our brains, the way they communicate, the levels are not balanced. So anxiety broadly, there are different types of anxiety disorders. It's a common mental health condition characterized by excessive worry, fear, nervousness, and it can manifest in various ways. Treatments are similar. You might go to a therapist and they might say, well, let's talk about lifestyle changes. What's causing the anxiety? Let's learn about coping strategies. Let's come up with some therapeutic interventions and strategies that help you manage the anxiety. Let's do box breathing like they did last time. Let's do some meditation. Let's change and work on the way you perceive and think about things, right? But then the clinician might say, you know, your anxiety, it's not manageable just with these therapeutic interventions. I think you need to maybe consider a medication to help balance the chemicals in your brain. And it's also true that sometimes you're dealing with a difficult moment in life. I don't know, you lost someone in your family, right? We know that the symptoms of loss and grief are real, but maybe these symptoms become complicated for some reason or another, and you just don't have the capacity to do therapy. So sometimes medications will bring you to a place so that you can engage in therapy. Um, left untreated can lead to depression, suicide risk, low self-esteem, medical issues. You have GI symptoms. Sometimes people develop ulcers because they're so anxious, and the chemicals in their stomach, the acidity starts to harbor. It can lead to sleep disturbances, which all of those things can lead to a weakened immune system. You can fall into substance use as a way of coping, and obviously impaired functioning, social isolation, and chronic fatigue, and the like, you name it. These are just some complications of untreated anxiety. So it's important to know when we're having a difficult moment, when we're sort of now moving into a place of dysfunction, you know. Another case study for mental health issues is bipolar. I wanted to illustrate this because some mental health disorders carry a higher genetic load. We know, like we said earlier, the biology, the environment, and our social interactions influence each other. If you contrast, for example, anxiety and depression, you would studies show that they carry a higher environment and social sort of burden. If you look at bipolar and psychotic disorders like schizophrenia, for example, they carry a higher genetic burden. So usually somebody who has schizophrenia has a not so distant relative who also has schizophrenia. This is the truth for bipolar, which also can encompass psychosis and perceptual disturbances. So I wanted to illustrate those two things because treatment approaches are different when you have a disorder that has a higher genetic burden. So bipolar disorders, and again, this is a broad discussion about it, is a mental health condition characterized by extreme mood swings between periods of mania. And mania is, think of somebody who's extremely hyper, like hyper. And it can include hallucinations as well. And then so the pendulum goes from these moments of elevated, feeling good moments to deep depressions and low mood. Treatments similar to diabetes, similar to anxiety, include psychotherapy, lifestyle changes, and medication. I would have put medication in bold because this is one where you would need medication right away. A lot of times people with bipolar disorders, they land in psychiatric hospitals as well as people with schizophrenia. And the mainstream treatment is medication management to stabilize their brain neurochemistry before they can do psychotherapy and lifestyle changes. And usually for people with bipolar, they would need lifelong medication treatment to avoid relapse. If left untreated, you have constant mood instability, relational instability. You wreak havoc in your personal life, but also in the life of the people you love. Employment and academic instability. You have co-occurring mental health conditions like anxiety, again, substance use, hospitalization, risk of suicide, poor health habits, risky behaviors, change in brain patterns. um, the role of medication. So it helps helps address the chemical imbalance that we've been talking about. It stabilizes our moods and prevents extremes, highs and lows. It prevents us from relapsing as well. It prevents an episode from becoming severe and unmanageable or harder to manage. And it enables other treatments, which I think it's helpful. Sometimes people might say, well, I've been in therapy for this long and I just can't, you know. And so sometimes you'll say, well, maybe you need a tad of medication to help you gain what you need to from therapy. And therapists will be able to call this out. They will say, you know, we think that you might need some additional help. In cases where for anxiety and depression, you might have external causes of the symptoms, the medication may help you stabilize neurochemically while you deal with the root of a problem. So if this is a marital issue, a deep chronic marital issue where there's dysfunction and you're so dysregulated, you can't really talk about the marital issue because you're dysregulated. And so maybe the medication might help you regulate the chemicals in your brain so that you can go to a therapist and talk about the issue at hand when there are external behaviors. Sometimes there aren't external behaviors that we can pinpoint, and you still need medication and support. Some people have deeply entrenched or what we call refractory symptoms. These are symptoms that you do therapy and they don't subside. You do medication management and they don't subside. We are complex beings, and the mental health field is still, we've come a long way. We still have a long way to go. And so there are other treatment options as well for symptoms that are hard to treat with therapy and medication. So keep that in mind. These are the professionals that are trained and licensed to treat. I hope I'm not missing any of them. But you have psychiatrists, you have psychiatric mental health nurse practitioners who can diagnose but also treat with medication. You have psychologists, licensed clinical counselors, licensed clinical social workers who can do therapy and a host and battery of um, screening and exams to diagnose. Sometimes it's hard to know where to start for people. Primary care physician, if you don't have a specialist, is a good place to start. I know nowadays a lot of them are doing screening tools. You know, when I go see my doctor, they ask me the depression questionnaire. So if you don't have one of these specialists at hand, it's okay. If you have a primary care physician, you can start there because they can be sort of the first route to refer and to do initial screenings to make sure that things are not so acute. For children, their pediatrician is a good place to start as well, because again, they can do maybe sometimes some initial screenings before they refer out. But for complex mental health issues, you definitely want to find the specialist. In the same way, your primary care physician would say, oh, this has moved beyond blood pressure issues. Now you're doing other cardiac stuff is going on. You need to go see a cardiologist. Same thing with mental health illnesses. You know, some primary care physicians might feel comfortable prescribing low doses of anti-anxiety medication or depression medications, but at some point, if things get complicated, they will say, or if they don't, it's important for us to say, I need to see a specialist, a psychiatric specialist, to get the help that I need. There are subspecialties as well. The training is so vast. If you're dealing with post-war issues and you have PTSD, you have therapists and clinicians that are trained especially in that area. It's difficult to find at times, but you do have specialized trained clinicians who do trauma care. You have people who work primarily with children and adolescents. You have clinicians who primarily do work with anxiety and depression. So sometimes it's broad, but sometimes it's good to narrow down if you can what you need and find the specialist that kind of has extra expertise in that area. Some people are child and adolescent providers, some people are adult providers. And so it's important to understand that. Some clinicians will, they are trained to screen, to do exams, to do physical exams. Some people might, some clinicians might have you do blood work so that we can rule out other medical reasons for why some of these symptoms might be. We know, for example, the thyroid and imbalances in our thyroid can lead to similar symptoms of mental health. So if we stabilize the thyroid, then we can manage some of those symptoms. Clinicians might provide you with questionnaires so that they can help sort of narrow their diagnosis. It is not easy to diagnose someone. There is no objective way of knowing whether you have depression, anxiety, bipolar. We cannot do a test that tells us, yep, positive for bipolar or negative for depression. We don't. We use our clinical experience, we use patient history, we use questionnaires, we use collateral information from families, from loved ones, from caregivers with kids. We use information from teachers to grab all that information together to make the best diagnosis. And therefore, there is some trial and error sometimes because mental health issues can be very, very complex. So it takes us time to get to know someone. And I know that's hard because the person with the illness wants an answer right away. And I say this to encourage you and let you know that sometimes it is a process. Yeah, sometimes it's not a good fit, and you may need to find a better fit for you. Sometimes you feel that you've exhausted what this provider can give you, and maybe there's something else that's needed, right? So always listen to your intuition as well. And as advocates for people who are at a place of dysfunction and can be their own advocates, then us being their advocates definitely be aware of those things so you can have your questions and your discussions for when you see your doctors. Some medications require ongoing blood work because they can cause side effects. Some medications require what we call a therapeutic level in the blood, meaning this percentage of the medication is now in the blood. We know that it's working well. And we also want to make sure that it doesn't go beyond what's therapeutic and now is causing issues. So sometimes, depending on the medication that you're on, you may need to have ongoing blood work and other tests and exams so that we can monitor for side effects, unwanted side effects. Self-care ideas. These are some. I always like to start with spiritual because I think that's what anchors us as Christians. I know it does for me. So prayer, I think being a daughter, being sons and daughters of God gives us a lot of hope. And so for me, self-care begins there. And then is complemented by all these other things. So spiritually, there's prayer, there's spiritual meditation. I have an app where I do spiritual meditation before I go to bed because I tend to be anxious before bed. There's different types of worship, listening to Christian music, coming to church, fellowshipping with believers, obviously reading our Bibles and getting hope from there. There are Christian retreats. I've done a silent retreat 2 years in a row, and they are amazing because you can be in silence in nature and just really reflect and hear the the birds, the water, wherever you are. So Christian retreats are also another way of self-care. Acts of kindness when we can. Sometimes we're so downtrodden that sometimes we can't give, but acts of kindness sometimes bring out the best in us. Practicing gratitude in the midst of difficult circumstances. We know that we can always have something to be grateful for. Emotional and mental self-care ideas include mindfulness, journaling, creative activities, learning a new hobby, re-engaging in a hobby that you liked, positive affirmation. Opal, your husband was wearing a hoodie today that says you are enough. And so sometimes we need to hear those affirmations. I have a Rolodex cards of positive affirmations that I read every morning that just remind me that I'm a child of God and that I'm valued. Um, Reframing of our thoughts, which is something that you can learn in therapy as well. How to take our thoughts captive, how to take a misperception and turn it into something different so that we're not feeling so negative. Obviously, you know this, exercise for physical self-care ideas, exercise, being outdoors, the sun, the fresh air, it helps. We call this behavioral activation. That's a fancy word that means that you do the opposite of what you feel, because we know that going outside will ultimately do us well. So we activate our brains, we bring the endorphins, which will help us feel better. Having a balanced nutrition, reducing screen time, avoiding substances, and then socially connecting with loved ones, joining groups, volunteering, setting social boundaries. Sometimes we overfunction, and we overfunction for too long, and we find ourselves discouraged, desperate, burnt out. And so sometimes we need to know when to take breaks. We need to have a close friend next to us tell us, don't worry, I got this for you. You can take a break. Um, these are just some ideas of how to self care. The National Alliance of Mental Illness. NAMI is one of the largest grassroots organizations. They have local chapters throughout the nation, and they are a hub for all sorts of resources, um, for people dealing with mental illnesses, but also for caregivers. Think of it as a support group where you can go and get resources, referrals, but also find people with shared experiences. And I don't think there's anything more valuable than talking to someone who can relate to you, who you don't have to explain anything to, because just by looking at you, they sort of know what you're going through. So I'm going to read this. I thought this was important to segue into our next section. Um, so we know that negative attitudes and beliefs towards people who live with mental health conditions is pervasive within the US and can be particularly strong within the Black community. Although beliefs and attitudes vary, research shows that many Black adults, especially older adults, view mental health conditions as a consequence of personal weakness. As a result, people may experience shame about having a mental illness and worry that they may be discriminated against due to their condition. For many in the Black community, it can be incredibly challenging to discuss the topic of mental health due to how they may be perceived by others. This fear could prevent people from seeking mental health care when they really need it. Additionally, many people choose to seek support from their faith community rather than seeking a medical diagnosis. In many Black communities in the US, the church, mosque, or other faith institutions can play a central role as a meeting place and source of strength. Faith and spirituality can help in the recovery process and be an important part of a treatment plan. For example, spiritual leaders and faith communities can provide support and reduce isolation. However, they should not be the only option for people whose daily functioning is impaired by mental health symptoms. And I wanted to bring that home because I think we know that as minorities, the Black community, the Latino community, we're kind of the last ones to seek help. Other ethnic, racial groups are getting the help sooner and having optimal health before we are. And we're also stricken by other external things, health disparities. We go to the doctor, they don't believe us. And so it's important that for the things we can control, we're seeking the help. And I'll let Cheron come up for this section. And Cheron, after you're done, I'll do a quick meditation exercise with the group when you're done.
I'm not good with the clicker. Which one do I get? Okay, just right there. Okay. All right. Thank you so much, Maria. This is awesome. It is very important to understand the role that we play as a church. Part of it is just offering supportive community in a sense of belonging and purpose. Understanding that this is a safe space that we as a church that we are providing this space that there's a level of connectivity. Oftentimes people don't have any other connectivity outside of the church. And so when you see people at church, understand the role that you play. It's not a small role. Um, Provide practical aid, meals, transportations, and the like. Making yourself available. Sometimes it's the small acts of kindness that makes a big difference. seeing somebody in need, or somebody who, you know that they got to be at the hospital for a period of time, and you, okay, going to the hospital to sit with them, or taking a meal over there, or somebody who has a sick little one, and the husband work all day, and you know what, for you to go and do those things, and it shouldn't take the minister or one of the leaders in the church for you to act. You're a part of the community. That should be on your heart, just as a member. If you are part of the church, when you act, that means the church is acted. Okay? Sometimes people think, oh, unless the ministers do it, then the church has not. You are a member of God's body. So when you do something, as that song that Carlos sings, we're the hand and the feet of God. Okay? Address spiritual misconceptions and complete professional care. Making sure that sometimes people say different things, or I'm just going to pray it out, or I'm just going, those prayers good, but you also need to be encouraging people to get the help that they need. Like I always say, if you have something that's going on with your knee, you're going to go to the doctor and you're going to see, orthopedic. Okay. That needs somebody who deals with the bone and all of that. If you have a situation that's going with your heart, or a rhythm, or even that's even specialists within cardiologists. Like my husband, he has a heart rhythm specialist. You know what I'm saying? Because they deal with the rhythm. If your rhythm is up, you do that. If you need glasses, if your child can't see, and they have the squinting at the, looking, guess what? You take them to the doctor, right, to address those issues. But oftentimes we can minimize that, and we need to make sure that we are too encouraging people to get the support that they need. And of course, things like this: provide education, train leaders to recognize concerning signs. These are the things that we can do as a church. This is one of the purpose of this workshop, to educate, to provide information, to empower each other so that people can get the help that they need. One of the things that we did in Next Gen last quarter, I think it was last quarter last year, we for the first time did a unit on mental health that Opal and Paula presented, and it was phenomenal. Really teaching the youth, empowering the young people. And let me tell you, so much came out of that. So many of our young people got the courage to say, hey, I need help. So many different parents called and thanked us because their children are now in therapy. And they had the courage to identify what was going on and had the courage to say, I'm not well. And it's so inspiring to me. And the kids now, they don't feel like it's a shame. It's not. They don't feel bad about it. They feel empowered. They feel like, okay, something's off here, and I'm okay to say it. And it doesn't mean that something's like just something. I'm just making up something. And it's so encouraging because I look at these children and they are flourishing. They are thriving. And it just so inspires me. But that is because of what we did to empower and equip the kids. And it also helped them to also be able to recognize in their peers. Because we had many kids who were like, people are coming to them and they didn't know what to say or do. You know what I'm saying? And they felt the weight and the pressure. And also help them to understand what weight responsibility is not theirs. And how to help them connect to the resources and the numbers to call. And then Pace Consulting donated books that specifically address mental health for the adolescents age group so that they can also have a firmer understanding. But oftentimes what I'm seeing the problem is the parents. And that is what is unsettling. And that is what can sadden me, keeps me up at night sometime, and it really breaks my heart. And of course, anybody who knows me, I'm down for the children. You know what I'm saying? So we gonna fight. It's gonna be what it's gonna be. Okay. And And sometimes as parents, I think they minimize. They minimize when your kid is not talking to you for weeks at a time. As she talked about the different signs, there's distress, there's a change in their behavior, they're not eating, they're not engaging. There is different things that are happening. And I appreciate you how you say, here are the people who you can talk to, the professionals. Let me give you a secret. Your pediatrician cannot diagnose mental illness or there's a mental problem. They can say there's something, but it has to go beyond that. You have to go beyond it. They can point you there, or sometimes they can maybe say, oh, there's a little, but you know as a parent, you know in your heart when something's not right. You can feel it. Anybody who's his a parent, you know. Even as a person, God has given us that sixth sense. The Holy Spirit. The God, how he created us, that we can tell when there's something, you know what I'm saying? We may don't know what it is, but you know it's something. And that's where you got to speak up and speak out. And if your primary care is not listening, you talk to a friend. You talk to someone, and of course, trust me, I think all of us here, if you don't have that good friend, you come talk to me. And I definitely, Paula, know I'm the one, the biggest advocate when it comes to mental health, to get you connected, provide you with the resource. I will walk with you, talk with you, and use everything in my power to make sure you get your needs met and your child get their needs met. Talking about mental health with children is the same thing. Like it should be a part of regular languaging. In our family, it's talking about mental health. It's no big deal. It's no shame. It's just like anything else. We talk about the NFL. We talk about the NBA, and guess what? We talk about our mental health. And making sure that everyone gets the support that they need. So I appreciate everyone what is sharing, and I know we have a lot more to talk about, but I want you are the church. It's not just Daryl, Carlos, Abu, Ray. We are the body of Christ. And I want to share this scripture before I close here. It says, in 1 Corinthians chapter 12, I'm not going to read the whole thing. We're familiar with it. Verse 21. It says, the eye cannot say to the hand, I don't need you. The head cannot say to the feet, I don't need you. On the contrary, those parts of the body that seem to be weaker and indispensable, and the parts that we think are less honorable, we treat with special honor. And the parts that are unpresentable are treated with special modesty, while our presentable parts need no special treatment. But God has put the body together, giving greater honor to the parts that lacked it, so that there should be no division in the body, but its parts should have equal concern for each other. If one part suffers, every part suffers with it. If one part is honored, every part rejoices with it. Now you are the body of Christ, and each one of you is a part of it.
All right, so somebody asked about questions. Cynthia, we'll have a few minutes for questions. I'm gonna do a quick. So these are additional resources. Like I mentioned, the National Alliance on Mental Health Illness. They have a Maryland chapter. Some people have tapped into NIMH clinical trials for some complicated things. There's a subspecialty now with mental illness where we are sort of up and coming, finding that maybe there are inflammatory processes that are happening as well that lead to mental health symptoms. So more and more that is developing. SAMHSA, which is the Substance Abuse and Mental Health Services Administration, Mental Health Association of Maryland. Psychology Today is a great resource for people who are looking for therapists. You can kind of filter there. I think the best way is referral. If you can, come talk to us. We can refer you to places because sometimes it's hard to find a place. For crises, yeah, you have 988, the suicide and crisis lifeline. And obviously, when you're dealing with a critical condition, you call 911 for emergency help. So we'll do a guided meditation exercise. This will just be brief, a couple 2 to 3 minutes. So I want you all to settle into a comfortable seated position with your back straight but relaxed. Allow your eyes to close gently or soften your gaze towards the floor. Take a few slow, deep breaths. Breathe in through your nose and exhale slowly through your mouth. Feel your body begin to relax with each exhale. Now let your breath return to its natural rhythm. Bring your full attention to the sensations of the air, moving in and out of your body. Notice the feeling of your belly rising and falling, or the air moving through your nostrils. Don't try to change your breath, just observe it. If your mind wanders, as it naturally will, gently notice the thought, and then guide your focus back to the sensation of your breath. If you're distracted by sounds, simply acknowledge them and return your attention to your breath. Now, begin to use your imagination to picture a place where you feel completely peaceful and safe. This could be a quiet beach, a serene forest, a cozy room, or anywhere else that brings you a sense of calm. As you visualize this place, try to engage all of your senses. What do you see? What do you hear? Is there a gentle breeze on your skin? Can you smell anything? The more vividly you can imagine it, the more real it becomes. Let the feeling of peace in this special place wash over you. Allow any tension to drain from your muscles. Feel your body become heavy and relaxed, as if you are fully supported by the ground beneath you. Take a moment to carry the feeling of calm with you. Feel the calm in your chest, your stomach, and the rest of your body. Slowly bring your awareness back to your breath. Begin to notice the feeling of the chair or floor supporting you. Wiggle your fingers and toes. And when you're ready, slowly, gently open your eyes. Take a moment to reorient yourself to the room before you begin your next activity. There are several of these. They're spiritual guided meditation exercises, which are my preferred because it anchors me back to my relationship with God. You can find these in apps. You can find these in many different places, and they can be helpful as an additional tool and resource. These are my citations. And then let's break the stigma of mental health illness and support one another. And if there are any questions or comments, I'm happy to take them. Questions? Cynthia, go ahead. You can come to the mic so people can hear you, yeah.
The first question that I have is, are there any standard guidelines for the frequency of blood monitoring for individuals who are long-term?
Yes. So it depends on the medication, and each medication will have standard monitoring. I can go into the details or talk to you separately, but yes, there are standards for how frequently you have to monitor blood levels for certain medications. Okay.
And then you have better health. I've heard of psychology today, but I guess the world says better health, better health. I haven't heard you guys say anything about better health.
I've heard of BetterHelp before. I'm not familiar with them.
Curious about better health.
Okay, go for it, Paula. I've heard of them, but I'm not too familiar with them, which is why I didn't put them up there.
So, just so you know, the reason why you're hearing about BetterHelp, Cynthia, is because private equity people have poured a lot of money into them, and so they have a lot of marketing money. And so, just so you know, companies like BetterHelp made over COVID like $700 billion just on people's mental health issues. And so, I'm saying that to everybody. Like you can go to wherever you want, but as clinicians, a lot of these people are making money off of people's illnesses, unfortunately. And so you want to go to, like you said, like referrals, real people, right? Better help. The reason why I'm not, you know, Rissa, you can back me on this, right? They do unethical things like text therapy. And while that maybe sounds cool, for it's unethical, right? And so like, oh, let me text, let me have a text session with my therapist.
Mm-mm.
Like that may be, but it's not therapy, right? And so you just really want to be mindful of like when you hear companies like that. So I had to get up because I'm like, it burns me as clinician, and what it's doing is putting like people like Carissa and Opal and Lisa and like myself. It really does make like it's not putting us out of business, but it's starting to like it's like think of like the WalMarts taking like the putting the small businesses out of business, right? So just be careful. That's all I have to say. Yes, 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 yes. No, thank you. No, I'm so happy you said that. So just be careful. That's all.
Yeah. We also didn't touch on, whether to seek Christian therapists versus non-Christian therapists. I think this is a larger and broader conversation. Sometimes there's experience that with Christian therapists, they sort of over spiritualize things and are not as helpful as other therapists. So again, this is another thing to bear in mind and to do some research on as well. Yes, Maxine. Uh, wow. Yeah. Good. Laura.
Okay, so also for better health, I know it's offered through your employer if you have FFA. So that's the option. But what I will say, like Cynthia, I get it. But my therapist, she really wasn't guiding me. Like I was looking for more substance. And I told her that because she asked for my feedback. But it's just, I mean, I think it is good for the short term if you need that. But I know that it's a big push with different employers, like with your EAP program. You see a lot of that advertisement.
Yes.
So I heard you mention autism, and I hadn't really thought about autism being, fitting into that. So could you elaborate? I have a grandchild that has autism, so I'm not sure how that relates.
Yeah, so autism I would put in a separate category. It's more like developmental um, issues that are happening. But sometimes when children have autism, they may struggle with something else. Now, all of these mental illnesses and even developmental disorders are on a spectrum as well, from mild to really severe. So there are instances where behavioral things that are manifesting in a child with autism might need to be helped by some psychiatric medications as well. But they are, I would say, in a different category. Yeah. Lanre.
You mentioned something about the brain
Yes.
early in your presentation. I'm curious, can mental illness be inherited from parent to child?
Well, genetics talks about that, which is why I mentioned that for some mental illnesses, the genetic load is higher. Most people with schizophrenia have a direct relative with schizophrenia. A lot of people with ADHD have a direct relative with ADHD. We don't know, though, what biomarker it attacks. We don't know which DNA is affected in particular. Like, some diseases, they can do a test and they know that if you have this allele, then you're going to develop this illness. With mental illness, we don't have that yet, but we know that there is heritability that plays a role, particularly more with some illnesses than others. Medications target the chemicals in the brain, which is how we know that these are brain disorders, because all the medications target these brain chemicals, but when they target the brain chemicals, they kind of cause issues in other areas, which is why it's not perfect. And that's similar with, I don't know, chemotherapy, right? It attacks our good cells too, so it's sort of similar. It's hard to kind of like pinpoint exactly how much, where, when. We know that there are cortex differences between some people with mental illnesses and healthy brains. So yes. Sherry. I think when you don't see, some clinicians will give you questionnaires. They give you questionnaires sometimes to assess initial symptoms, but sometimes they continue to give you questionnaires to assess improvement or lack thereof. But I think that if you're still feeling distress, if you're still feeling unresolved overall about your well being, if you feel like the person is not taking you to the issue itself or to what's happening, it might be a sign that they are they've hit their plateau. Now, when we get formal training as therapists, we get a host of modalities. It takes a lot of work and effort on the part of the clinicians to continue to develop themselves after they're done with their school training. It's not enough what we get in school. We need more of that. So a clinician or a therapist should not be a person that tells you, "How you doing today? How was your last week? What do you want to talk about today?" No, they should have the tools and the structure in place to take you to the place where you get the help. And I think that talking to people around you and also being introspective, you can have clues and indications that maybe this is not as helpful as you think it should be. It and it also depends. We're also talking about different illnesses too, right? There are some illnesses like schizophrenia, for example, you're only going to get but so much because it's such a deeply impairing illness that there will be the person will experience some form of disability for their entire life, right? So it depends on the illness, it depends on the diagnosis, and it depends on the severity of the issue and how open you are. When I was doing therapy, I was like, look, I got nothing to hide. This is all it is. And I think if you are healthy enough to be able to engage in therapy that way, you can see more progress faster. Go ahead, Sharon. Yeah. Mm-hmm. Opal, were you going to share something? I would also say that it's uncomfortable sometimes. And discomfort is not always an indication that therapy is not working. Discomfort is often an indication that you're doing good work. I mean, when I had my therapist, I was ready to quit for the first 2 months because she was like, Maria, we're not talking about this other person. We're talking about you. And that's uncomfortable because depending on the issue, sometimes you have relational issues and you want to come and talk about whoever, right? My husband, or and they're like, let's bring it back to you. So discomfort is also to bear in mind because sometimes people they initiate and it feels too uncomfortable because your therapist is taking you to these dark places that we all have, and it's just there's this dissonance because now you think, well, something's wrong with me, but I think that's the wrong perception, right? No, nothing's wrong with you. We all have issues that hinder our best selves from being able to, come out, and so that discomfort can sometimes be a sign that good work is being done, and maybe no discomfort is it's an indication that maybe good work isn't being done. Yeah. Yeah. Yes. And that's real. It is very real. Which yeah, and that's real. I mean, we have a couple of things happening. One, we're complex human beings. Two, mental health disorders are very complex. It's not one size fits all. Sometimes you're not dealing with one thing, you're dealing with multiple things. And three, the field is so saturated, and like anything else, you have people who are more invested than others. We have the what we talked about here, right? We have health disparities also playing a role, which is why these workshops are so important, because if we're educated, we can, one person at a time, be advocates, and advocate for optimal health. You're right. Sometimes it's not, all I can say is it's complicated, when you get a really, really sick individual in front of you, where to start, how to diagnose them, and how to treat them. A lot of the medications are groups of medications that target one thing or the other. They're not always effective. Sometimes they're effective to a point and then people relapse or plateau. So there continues to be a lot of work in progress in the mental health field. Octavia. So, what I will say is that medical marijuana and recreational marijuana are not constituted the same. So, the constitution of medical marijuana, and you're right that sometimes it's been prescribed for also neuropathy is been prescribed for anxiety. That's not my specialty, but I do know that the constitution of how medical cannabis is made is different than how recreational cannabis is made. Constitution meanings, the chemicals, how they're put together, they're different. And obviously, medical marijuana is prescribed. So you get a prescribed dose, a prescribed amount, take it these many times a day. Recreationally, people are using it whenever they want, right? So there are differences there. And then because we know that there's heritability with disorders, and we don't know what our heritability is. I don't know if me using recreational marijuana is going to trigger genetically a psychotic break. So it's really, I have concern for our young population. Yeah. Yes. Yes. In the same way other medications, right, can be abused. Stimulants, which are prescribed for ADHD, are abused by many people who take it unprescribed and abuse it and take high volumes and high quantities of it and have all kinds of negative effects from it. So the principle is kind of parallel, if that helps. Jonathan. Grow therapy? I've never heard of them. I really think it's a personal choice. I think a good therapist can be effective for, I think, adults, um, both in person and virtually. I have a little bit of mixed feelings about this with children because children require more touch. Sometimes there's play therapy, there's sometimes more observation that has to be done of the whole body. They're not doing talk therapy like adults can. So the engagement is different for children and adolescents. I think for them, in person is probably still optimal, but adults who can engage in that sort of talk therapy, I think when you have a therapist that you have a good fit with, it can be very, very effective as well as in the office. Yes. Mhm. I agree. You're welcome. Cynthia, one last question and then we'll wrap up.
Is there an age where a child has the right decision around seeking help, or like also as a parent, knowing that your adult child needs help? Because I know age is a big factor.
Yes, similar for other things, right? Minors, we can sort of force them to go get help, whatever that means, right? But when they become adults, you can no longer, they have to be their autonomous person. Obviously, if they're in crisis, you can call 911 on their behalf. But it's hard to sort of force someone to do work, right? Even a child, for lack of their, we can take them to therapy, but if they're not engaging and shut down, there's not going to be work. So, minors are minors and adults are adults, and the adults have to be their own consenting adults to engage in therapy. Sometimes, Carissa, Paula, 16, 15 maybe. Go ahead, Paula. 12. Mhm. Yep. Yeah, so the sort of pros and cons. Mm-hmm. Yeah. All right. Thank you, everyone. All right. Thanks, everyone. You always have kids who come into. Thank you, Rodney. Appreciate you.